Hello, my name is Bill Berquist. I'm a member of the Global Psychology Task Force, and we're addressing the psychological issues associated with the coronavirus outbreak and the massive challenges that the global outbreak really poses. This particular video cast, one is focusing on what I'm calling communities of the heart. And specifically, I want to look at communities of support, communities of health, and communities of commerce. Just a kind of prefatory note, my own interest in communities began many years ago when I had the fortune of having Robert Bellah as my instructor. And Robert Bellah and his colleagues went on to write a very influential book called Habits of the Heart. This work was in turn based on the work that was done by a Frenchman named de Tocqueville way back in the 19th century. He was interested in the nature of democracy in America. And one of the things he discovered is democracy was alive and well, often in communities that I would call communities of heart. And that Robert Bellah and his colleagues talk about as habits of the heart. Seems to me that as we deal with the virus outbreak and the challenges of the virus, we need communities of the heart even more than we ever have before. And I want to just talk in this video clip specifically about these three communities. So let me start with communities of support. Now, the first thing I want to suggest is get Zoom if you don't already have it. Zoom is the tool I'm using right now that you're listening to. Here on the website, we're providing a link to Zoom that has been set up specifically with regards to the coronavirus. It's instructions of how you can set up Zoom. Zoom is a way to essentially access the outside world. It's a way to build and connect with communities. Telephone is okay, but visual modes such as Zoom or Skype, but I would suggest you look at Zoom, is preferable to telephone. Obviously, we're all missing the direct personal contact with other people, but at least visual contact is better than just auditory contact, which you would get obviously with the telephone. So support groups. What we're doing on this website is we are trying to identify what are some of the areas where there can be psychological stress and strain. We're talking about it in our role as parents with children. We're talking about our role as parents to our own parents. We're talking about in terms of our own struggles if we are infected or if our loved ones are infected. We're talking about it in many different ways. And one of the things I would strongly recommend is don't go it alone. There's wonderful opportunities to build support groups. You might find colleagues of yours who also have children living at home with you. How do you get together in the evening or whatever, especially after the children have gone to bed, and talk about what you're doing, what's possible? You also can help one another. For instance, if you're having to do teaching at home, how do you help one another in terms of discovering activities that are of interest to your children that are educational in nature? You may want to have a support group with people where the parents have come to live with you, or ones where your parents are in a retirement home or assisted living facility where the challenges of outbreak of the virus are particularly strong and where usually you cannot go meet with them in person. How do you connect with them? How do you provide support? You may want to talk about this with other people who are in a similar situation. So I encourage you to consider setting up support groups. A few years ago, this would have been very difficult, very challenging. So we can even say, fortunately, the virus has arrived at a point where we can do something about it with video communication through the use of Zoom. So you should consider this as a community of support or multiple communities of support. And elsewhere on this website, we're going to be providing a number of connections, a number of suggestions about how to set up the support groups. Well, the second community of heart is certainly one that's filled with enormous amount of heart, and this is the community of health. We can all applaud the extraordinary courage, commitment of healthcare workers right now, whatever country you live in, because they're obviously risking their own lives to do this work. It also typically means, especially right now, that they're overwhelmed. They're overwhelmed because there are many patients coming in. They're overwhelmed often because there's inadequate supplies available. They're often overwhelmed because essentially they have to somehow in those hospital systems deal with people who have other illnesses along with those who have the virus. They also have to deal with the fact that people coming in who are just simply afraid, who don't really have the virus, but they want to be tested or they want at least some comfort, which is very understandable. Given these conditions, one of the recommendations I would make is if you do want to contact your healthcare professional, your primary care physician, a nurse assistant, physician assistant, etc., you need to have done some preparatory work. That is, that you need to make sure not to waste their time, which means you ought to write down the questions you want to ask. Make sure these are questions that, one, they can answer, or they best answer. Some of these you can get from the website. And by the way, on this website, we are providing a lot of links for you to answer some of your questions with the Centers for Disease Control and Prevention, World Health Organization, etc. So some of these you might be able to answer without having to bother someone in your local healthcare facility. But if you are going to connect with them, one, I urge you to use Zoom with them or telephone rather than going into their office. When you go into their office, they typically have to themselves put on certain gear to meet with you in case you are positive. That costs money, takes time, etc. So if possible, you should try and do this by phone or better yet, by Zoom. And once again, be prepared with the questions you want to ask and try to be as clear and succinct as possible so that you don't overwhelm them. Third, I want to talk briefly about the community of commerce. As we're all aware, the virus is impacting on us in terms of our health and well-being, but also in terms of the economy. Many businesses are closing down, they're having to lay off employees, etc. Governments in most countries is trying to struggle with this, but it's impacting clearly on the businesses that we typically engage. Let me talk specifically about restaurants. Many of the restaurants are closing down, and some of those may never open again. As you probably know, restaurants typically have very narrow margins in terms of profit, and it doesn't take much for them to be belly up. Now, what some of the restaurants have done, kind of following in what the fast food restaurants have done, but what they're doing is that they're asking their patrons to order their food by phone and then have it picked up at a particular time. So I'm going to order this steak and potatoes and green peas, and I'm going to come by the restaurant and pick it up at 6:30 in the evening, something like that. And they come and they actually hand you the food at your car. So there's minimal contact, and they typically assure you that all of the tools, even the bags in which the food is being delivered to you, is sanitized, etc. Now, the food is certainly not going to be as good as it was in the restaurant, and you just, the smells, the flavor of the cooking, all that, is not there. But food is good, and more importantly, you're helping to keep that restaurant alive and well, and you're supporting them in their efforts to be innovative in their practices. Then at home, of course, the joy we have is we can eat that meal with our family. And it's a way in which we can make it into an evening of celebration and thankfulness that we are alive and well, and that our world, our nation, our local community will recover from this crisis. But it requires that we build communities of heart, and it requires that each of us become part of that community. And just as a final note, this whole global psychology task force is itself a community. And we're hoping that you will join this community, take advantage of the resources we have on this website, and potentially even work with one or more of our task force members who have a lot of ideas about and experience in working with health-related issues. Anyway, thank you very much.